If you have one of the following thyroid conditions, surgery could be recommended by your doctor. Large goiters or thyroid nodules causing symptomatic obstruction such as swallowing, voice impairment, or breathing difficulties. Thyroid cancer is a common reason for thyroidectomy. If you have thyroid cancer, removing most, if not all, of your thyroid will likely be a treatment option. Your surgeon, together with a multidisciplinary team, will evaluate if thyroid surgery is recommended for you or not. You will then take the decision together. Different types of thyroid surgery exist. A total thyroidectomy is surgical removal of the entire thyroid gland. It is generally a safe procedure, and the main advantage of this method is that since the entire thyroid gland has been removed, there is no need to reoperate in cases where the nodule is then definitively diagnosed by a biopsy as thyroid cancer. After the surgery, you will need to take medication, usually tablets, that contain thyroid hormones. This will be for the rest of your life to replace your natural thyroid function. A partial thyroidectomy is indicated when only a part or one lobe of the thyroid gland needs to be removed. When one thyroid globe is removed, the remaining portion may take over the production of hormones and maintain thyroid functions, in which case you will not need to take thyroid hormone tablets. The effects of a lobectomy are unpredictable. Sometimes partial thyroidectomy can still lead to hypothyroidism, low levels of thyroid hormones, and this means that you will need to take thyroid hormone replacement medication afterwards. Sometimes, a nodule which needs to be removed is in the middle part of the thyroid, or isthmus, which connects the two lobes together. A nodule in this region is rare, and removal of the isthmus is called isthmusectomy. If your thyroid lobes are normal, or if you only have benign nodules on them that do not need to be removed, then an isthmusectomy can be done through a very small incision in the neck. It is rarely necessary to need to take thyroid hormone medication after this surgery, as the thyroid gland lobes continue to function. In some instances, neck dissection surgery is necessary to remove the lymph nodes near the thyroid. This is sometimes necessary to thoroughly treat thyroid cancer. Removal of the lymph nodes can sometimes be done through the same incision as the thyroidectomy, but sometimes a larger opening is needed in order to reach the lymph nodes involved. This will result in a larger scar than you would have from just a thyroidectomy. Only some of the lymph nodes in the neck are removed during neck dissection, so that you should not have a higher risk of infections later in life. There are several types of thyroid surgery, and your surgeon will discuss with you which type is best for your situation. We will describe here the most widely used approach to thyroidectomy. In the classic approach, thyroid surgery is performed through an incision or cut that has been made in the skin of the lower part of the neck. The operation is generally performed under general anesthesia. The incision is usually made in a fold of skin on the neck to try to make the scar less obvious. However, its visibility after the operation will also depend on your own neck, as well as the position and size of your thyroid gland. The skin and muscle are then pulled back to expose the thyroid gland. The blood supply to the gland is stopped, and the surgeon can then remove some or all of the gland. During the operation, your surgeon will take great care to identify and avoid damaging the nerves to the vocal cord that are found just behind the thyroid gland. Injuring these nerves can severely affect the voice quality, ability to swallow, or breathe. To help prevent laryngeal nerve injury, your surgeon may use an intraoperative nerve monitoring system to locate the laryngeal nerve and to monitor its function during the operation. The surgeon will also take care to identify and preserve the 4 small parathyroid glands, which are located very close to the thyroid gland, and to control your body's calcium levels. Be sure to ask your doctor for a detailed explanation of the benefits and risks of the surgery, as well as his or her experience performing this kind of procedure.